Come in.
Hello, my name is Katie. I'm going to be your nurse today. First, I'm just going to close the curtain and provide privacy and just wash my hands. And can you verify your name and your date of birth for me?
Jody Floyd, 62785.
Oh, I'm just going to check your wristband, Mr. Floyd. Perfect. Okay, so the doctor has ordered a head-to-toe assessment on you. Is it okay if we get started?
You sure can.
Alrighty. So I know I just asked you, but again, can you tell me your name,
Jody Floyd,
your date of birth,
62785.
and do you know why you're here?
I feel fine. I don't know. Doctor just told me to come in.
You know what today's date is? You know what today's date is?
February 28th.
You know who the current president is?
Yep.
Alrighty. So my patient was a little difficult, but I would just document that patient is alert and oriented, times for the person, place, time, and situation. And just by looking at you, it doesn't look like you have any masses or lesions. Everything looks symmetrical. Your head is well, your hair is well groomed. Your beard is well groomed. Is it okay if I touch you?
You can.
Oh, I'm just gonna. It doesn't feel like you have any masses or lesions. It doesn't look like your beard looks like it's well kept. Alrighty, and your hair. Right. And have you been having any headaches recently? Any dizziness? Any falls?
Yeah, for my wife.
Oh.
She gives me a big headache.
Oh, Lordy. Have you had any confusion?
No?
No? Alright, so we're just going to move on down to your ears. Your ears look symmetrical. Have you had any drainage in your ears recently? I'm just going to check the other one. And I'm just going to do a little test. I'm just going to close one of your ears and just repeat after me what I say, okay?
Okay.
A, B, C.
A, B, C.
I'm just going to do the other one. 1, 2, 3.
1, 2, 3.
Oh, again, it doesn't look like you have any drainage. Do you ever hear any ringing in your ears?
Uh-oh.
Alrighty, perfect.
I've got selective hearing.
Selective hearing.
Yep.
Alright. Well, your hearing appears intact to us just having normal conversations. So I'm going to document that in your chart. Is that okay?
Sure.
Alrighty, perfect. So we're just going to move on down to your eyes. Have you had any blurred vision recently?
Yep. Had a ulcer on my left eye.
Do you wear, I see you wear glasses. Do you wear contacts as well?
I hadn't in the last 3 weeks.
Alrighty. So your eyes, I'm just going to check. Is it okay if I just move your glasses? Right. It doesn't look like your eyes have any redness. And look, your conjunctiva looks pink. And that's good. I'm just going to grab my pen light. Alright. It looks like your pupils are equal and round, and they're about 2 millimeters in diameter. And I'm just going to shine the light in your eye. I'm just checking, okay?
Alright.
I'm just checking.
1, 2, 3.
Alright. Just going to do the other eye. Okay. So pupils are equal, round, reactive to light. And now I'm just going to check to see if they're reactive to accommodation, okay? I'm just going to shine my light, and I'm going to see if your eyes are following the light.
The light's too bright. They ain't gonna follow that play.
Well, just try your best.
Okay.
Alright, your pupils are equal, round, reactive to light, and accommodation. They're both constricted bilaterally, so that's good. Alrighty, and we're just going to move on down to your nose. Have you had any nosebleeds, sinus pressure, anything like that? Okay, I'm just going to get you to close one side of your nostril and blow. Not too hard. Alright, do your other side. Alright, so we just assessed your nasal patency, so everything looks good. It doesn't look like you have any congestion or anything like that. Right. So we're just going to move on to your mouth, your throat, and your neck. So I already looked. Open your mouth for me. Alright, so your oral mucosa is pink. It doesn't look dry. No dry mucous membranes.
Excuse me.
And just while I'm looking, I don't see you have any jugular vein distension. Your trachea is midline. Open your mouth one more time. Does it look like you have any missing teeth, no caps, or anything like that? Have you had any difficulty swallowing or neck stiffness or anything like that?
No, we have all do that stuff.
Alright, well, I see your speech is clear and you're able to swallow without any difficulty. Alright, and I'm just going to move on down. Can I listen to your heart and your lung sounds?
I don't have a heart.
Alright, well, I'm going to see if I can hear it. I'm just going to pretend you're at a 45-degree angle. Alright, I'm going to start at your second intercostal space on the right side. This is your aortic area. Moving over to your second intercostal space on the left side. This is the pulmonic area. Your third intercostal space. This is the Erb's point. Moving down to the fourth intercostal space. This is your tricuspid area. And then your fifth intercostal space. This is your apical or point of maximal import. Everything sounds good. Have you had any chest pain or shortness of breath? No. Alright. And while I'm looking, I'm just going to hold your hand. I'm going to check your capillary refill.
How sweet.
Your capillary refill is less than 2 seconds bilaterally. And I'm just going to check your radial pulse. Your radial pulse is 2+. I'm just going to check the other side. The radial pulse is 2+ bilaterally. And now I'm just going to listen to some lung sounds, okay?
Okay.
Have you had any shortness of breath or any coughing, wheezing? Have you coughed up anything? Any sputum?
No.
No? Alright, I'm just going to listen to some lung sounds. I'm going to start in your right upper lobe. Moving over to your left upper lobe. Your left lower lobe. Your right middle lobe. And I'm just going to listen to your right lower lobe. This is your lateral lung sound. And then your left lower lobe. Also lateral. Alright, and then I'm just going to move over to the back. And just take a deep breath for me. And this is your left upper lobe. Over. Your right upper lobe. Your right lower lobe. And your left lower lobe. And you can lay back in the bed for me. Your breathing is even, non-labored. We would say describe that as eupnea. That means
Labor. I hope I ain't going to labor once.
everything is normal and no adventitious breath sounds are noted. So I'm just going to come over here and document that in your chart. And before we move on, I just want to educate you on an insenitive spirometer. This is what we're going to pretend this is. Do you like to watch TV?
Not really.
Well, when you do, I know you like to watch the news because I came in here and seen you watching the news sometimes.
That's all y'all got on the channel. I can't watch nothing else.
So every commercial break, just do this. We want you to do it 10 times an hour. Just take a deep breath in. This is just going to help expand those lungs and get everything working, okay?
Okay.
I'm just going to put this over on the side of your bed for me, for you. Alrighty, And now I'm just going to check you for any edema that you might have. So I'm just going to check your upper extremity first. Moving from furthest away closest to you. It doesn't look like you have any edema. Now check your other side. No edema in your upper extremities, and that's good. Have you noticed any swelling at all or anything?
Yeah, my gut.
Oh Lord, somebody must be cooking you some good food.
Convenience store.
The convenience store?
Yep.
Your wife doesn't feed you?
She barely knows how to cook.
Oh Lord, we're gonna have to get her up here in the cafeteria.
I sure don't want to teach her how to cook this food.
Oh. Well, I'm just gonna check you for some edema in your lower extremities. No edema. Whenever I press on you, it doesn't leave any indentions. So now I'm just gonna check your dorsalis pedis pedal pulses. It's 2+ bilaterally. Your posterior tibial pulses. 2+ bilaterally. So that's good. Nice and normal. And now I'm just going to move over. We're going to start on your gastro. Are you able just to, well, we'll pretend. I'm just going to listen to some bowel sounds. Is that okay?
Put here a racket.
Racket. Have you had a bowel movement recently? Are you able to pass gas?
Oh, yeah.
Alright, so I'm just going to take a listen. Is that okay?
Don't press too hard.
Alright, so first I just want to inspect it before I touch it. Everything looks rounded and doesn't look like there's any masses or lesions or anything.
Rounded, so you calling me fat lady?
That's how you want it. You don't want any crazy indentions. So I'm going to start on your right lower quadrant. I'm going to move to your right upper quadrant. Your left upper quadrant. And your left lower quadrant. And then I'm also going to flip my stethoscope over and use the bell of my stethoscope to check and see if I hear any swooshing. This is known as a bruit, and you don't want it. Alright. No swooshing sounds. So that's good. I'm just going to document that. Over here in your chart. Alrighty. And have you fallen recently or anything?
Uh-uh.
Oh. Have you had any trouble moving any joints or anything of that nature?
Uh-uh.
Alright, so I'm just going to start with your upper extremities. I'm going to hold my arm underneath your elbow, and I want you to just flex your arm, then extend it, flex, extend, and then I'm going to apply some pressure. So flex, and then extend. Alright, I'm just going to do this on the other side. I'm going to hold your elbow, flex, extend, flex, extend. I'm going to give you some pressure, flex, extend, flex, extend. Alright, and now I'm just going to move on to your wrist. I'm going to hold your wrist. I want you to flex your wrist, extend, apply some pressure, flex, extend. Okay, same thing on the other side. I want you to flex, extend, flex, extend. I'm going to apply some pressure. Flex, extend, flex, extend. Alright, perfect. I don't want to hear any cracking, popping, or anything of that nature. You have full range of motion with a strength 5 out of 5. Bilaterally, your grip strength is equal, so that's good. And now we're just going to do the same thing with your lower extremities. If I could just get you to scoot to the edge of your bed. Now I'm just going to inspect your lower extremities for symmetry, swelling, deformities. And I'm gonna do the same thing. First, I'm gonna just support your knee, and I want you to flex, extend, flex, extend. I'm gonna apply some pressure. Flex. And do the same thing on the other side. Flex, extend, flex, extend. I'm gonna apply some pressure. Alright. And then I'm just gonna do the same thing with your ankles again. Flex, extend, flex, extend. Apply some pressure. Same thing with the other side. Flex, extend, flex, extend. Perfect. Okay. And now I'm just going to assess your gait and your balance. Is it okay if you stand up? Do you need any help? If it's safe to do so, please just stand up for me and walk a few steps. Right? We'll just walk right here and do the heel, walk heel to toe.
Hey, crip walk.
Oh Lord, heel to toe. Alright, so gait is steady and balanced. And you're coordinated, and you can just come on back. Do you ever have any joint pain, stiffness, or weakness, difficulty walking or anything? Oh, you can have a seat back in your bed if you need any help. Oh. So I see you have some small pets. So I'm just going to gather up their toys. You don't want this in the way whenever you walk, okay?
That's my service dog stuff. You gotta leave him over there.
Well, I don't want you to fall.
He'll get him up by himself. It's fine.
So just lay back in the bed. I'm going to make sure you have your grip socks on. That way whenever you walk, you don't fall. Make sure you have some socks on. I'm going to make sure everything is in reach of you. I see you already have your phone. I'm going to set your drink and all your belongings over here on this table. That way you have it and it's in reach. And is there anything else that you need before I leave?
No, ma'am.
Alrighty. Before I get done, I just want to educate you how I did in the beginning that you were alert and oriented ×4. If you were unconscious or suffered any brain injury, then we would use the Glasgow Coma Scale. It says your eye response, your motor response, and your verbal response. So that would be only if you had any hit, injury, or trauma. Alrighty, well I hope you have a wonderful rest of your day, and the doctor will be in to see you shortly.
Thank you, ma'am.
You're welcome.